Today, I'm Nicole Shaneborn. You are here for Logic Models That Matter, powering the strategic prevention framework with data with Katie Shakoyan. Katie is fabulous, and I'm so excited you all will get to hear from her today. Logic models are powerful, and so it sounds strange to say we're going to power the strategic prevention framework, but they are a really powerful tool to help you move forward with your programming. We'll wait for people to join just a little bit. And if you want to put your name, your role, and where you're from in the chat, Richard has posted over there. Please share your name, location, and what makes you interested in this topic. We would love to know. We love logic models and want to hear why you are excited to be here today. Oh, we've got some people from Utah, Ohio, Minnesota. Let's see who else? North Dakota, Nevada, Texas. Wow, you guys are coming from all over. I'm impressed. And we really appreciate you being here with the weather situation going on across the US. We're glad to have you here today despite everything going on. So welcome. Katie, I think we'll go on to the next slide. We are here today to talk to you, but we do want to let you know these are not the opinions of SAMHSA or the Department of Health and Human Services. If you do have questions about our materials or anything today, you can contact us at pttc6@ou.edu. And now we'll talk about our learning objectives. So today we are excited to help you utilize the new Excel-based logic model template to document the strategic prevention framework. We also are going to describe how the tool supports data-informed planning across each stage of the SPIF. And then we are also going to apply some examples and resources to improve your own logic model and prevention efforts so that this is relatable to you. And now I would love to introduce Ms. Katie Shakoyan. Katie serves as our epidemiologist for the Southwest Prevention Technology Transfer Center. She provides training and technical assistance to support our regional clients around epidemiological data in their assessments and implementation of prevention efforts. She has over 15 years of experience on the ground and through research and evaluation, working to address social public health issues. She also has extensive project management experience. Specifically, she conducts needs assessments, develops logic models, and facilitates strategic planning processes. And if that wasn't enough, Katie is also a PhD candidate at Brandeis University studying social policy. So we are so happy to have her here today. Katie, I'm going to turn it over to you.
Thank you, Nicole. And I see my slide jumped right ahead of me, so it was even more prepared. I will say I'm already lost in the chat, so thank you all so much for being here, introducing yourselves. Nicole and also Derek are going to be helping answer questions that come up in the chat as we go. But if something gets lost, feel free to put it in again, or you can always come off mute and interrupt. I'd love to hear your questions as we go. Hi, Derek. Thanks so much for saying hello. So today, in our hour and a half this morning, we're going to start with some introductions, which we've already been doing. And then we're going to do a quick overview of the strategic prevention framework and also of logic models in general. Then we're going to jump into this new tool that we have and really work through a full logic model in this time that you can customize for your own needs. So we'll be talking about our problems and related behaviors, risk and protective factors. We'll move over and talk about short and long-term outcomes. And then you will have a chance. I am going to put you in breakout rooms for a short amount of time, just so you have that in your head as we're going, to actually put this into action for you yourself. Of course, we'll have time at the end for questions and evaluation as well. So to get started, there's a couple of tools that you need for today. One is your Zoom window. You're already here. You're doing great. Keep this open. Secondly, we have the logic model template for you. So I saw somebody asking, will you have that available? Yes, you can get it right now. So you can either click the link that Richard just put in the chat, or you can scan that QR code right on your screen. When you go in, you'll see that you have to actually click the link that says download the logic model tool to access the actual document from there. Then the other thing that you will need this morning is we have some of the slides from this presentation, not the full slideshow, but just a few of them for you to reference in Google Slides. And so you can access those. It looks like Richard put that in the chat as well. And there's also another QR code there for you. Those are just for reference as we get into talking about some of the data that can drive our logic model. All right, so let's jump in. What is a logic model? A logic model is a visual representation of how a program works. It's really for the purpose of clarifying what are the resources that we're putting into our programs, what are the activities we're doing, and then what are the intended changes that we're hoping to see because of the program that we're implementing. It's not always linear and it's not static. It shouldn't be static. Programs are really dynamic, which means that our logic model is going to be dynamic. It's likely going to be changing. We're going to be refining it throughout the time that you're running your programs. Another way to think about a logic model can be thinking about it as a story. So we have the sort of beginning, middle, end, where our beginning is what's going on in our community. That's the problem, related behaviors. That's even maybe our risk and protective factors, what's contributing to that problem. The middle is what are we doing? What are we implementing? Or the evidence-based intervention. And then the end are those outcomes that we're hoping to see come from our program. Would anybody be willing to either come off mute or put in the chat? I'd love to hear just one way that you have used a logic model that has been beneficial to you. And I do know we have a wide range of experience in this space. So some folks may be sort of just getting a taste of what logic models are. Others of you have probably been building these for years and running them. That's great. I'd love to hear all of that. But I would love to hear one example, someone who's used a logic model. Great. Josh, it can help focus project partners. Steve says evaluating contractor plans. Perfect. Wonderful. Can definitely be the foundation of evaluation. It helps just really think about how are we being really intentional, thoughtful, and data-driven throughout our program planning and delivery. Program evaluation, prioritizing goals, just beginning to work with logic models and looking to learn more. Wonderful. Great. And feel free to keep putting more thoughts in the chat. So here's the one way of thinking about a logic model. Think about your logic model as the plan or the roadmap. It can show us what our issues are, what's contributing to them, and what we're going to do about it. So many of you are likely familiar with some version of a logic model that looks kind of like this. This is the one that's used in the SAPST training. Doing a really quick review just to get everyone on the same page. So in the past, when we were looking at problems that were faced by a community, we typically went straight to finding a solution and selecting interventions. That makes a lot of sense. The problems that you all are dealing with in your work, they are often feel really, really urgent. Taking that time to do the planning can feel like a luxury that we just don't have time for, right? It's also a lot more fun to do programs than it necessarily is to plan programs, at least for many of us. I actually love the planning phase, but that's why I'm in this role, right? Most of our coalitions are really focused on action, right? So all of these are reasons why we often jump in and do before we take that minute to sit back and think about the logic behind our work. But without good and solid planning, that kind of approach is really sort of just throwing programs at problems. And what we found in the field of prevention is that that approach didn't work very well. So instead, the strategic prevention framework process really recommends that we use data to learn about the problems that exist in our community and look at the factors that influence and contribute to the problem. And then, based on those two pieces, find the best possible intervention to address those factors that are contributing to the problems in our specific community. So that's the logic behind this logic model. And now that as a field, prevention is using the logic model in this way, it's working a lot better. So we think about logic models, sometimes we'll hear different words for some of these concepts. So problems and related behaviors might be called consequences or consumption. Risk and protective factors are sometimes called intervening variables or causal factors. Interventions might be referred to as strategies. Whatever terminology we use, the logic model really increases the likelihood that our prevention efforts are going to be logically connected to the factors that are contributing to the problems in our community. And then that logical connection is why we can reasonably expect that our prevention interventions will make a difference in our community. I see there's a ton of great stuff coming in on the chat too. Thank you for continuing to do that. So let's take a look at this new tool that we are excited to share with you. The link, I believe Richard just put it back in the chat. Thank you. There's also the QR code there, so if you haven't downloaded it yet, you can. If you're having trouble accessing it, feel free to put that in the chat and we will help you get there. So we're going to walk through this as we go. This is a screenshot, obviously. You can poke through some of those tabs as we're talking. The idea is that we are going to use this logic model to look at some real data. And then as we go, you're going to be filling this out, thinking about, based on the data I'm sharing with you, what's relevant to your state or your community. And I'm just giving you a couple of tidbits of real data. So obviously you would be looking at a lot more on your own, but here's a sort of way that we can use it as an exercise. So let's check out how this tool can be useful in your prevention work. So we're going to start by looking at problems and related behaviors, the left half of that logic model. To do so, we're going to need to understand relevant data to your communities. So what follows here are just a couple of slides of national and statewide data from the National Survey on Drug Use and Health, the NISDA, between 2021 and 2024. This is one type of a data source that you might use to assess the needs of your community. As we look at this data, think about the problems that they show are most pressing for your state, and you might want to be considering questions like, what rates are highest for your state? What trends are concerning to you? And how does your state compare to the other states in the region? And I've presented here Region 6 data. So looking nationally at teen usage data over the past month, looking at 2023 and 2024, across the board, when we look at different substances, we're seeing the highest usage rates for marijuana, nicotine, vaping, and alcohol. And then we look across time trends, we're seeing a downward trend for nicotine vaping, which is down about 0.8%. Binge alcohol, about 0.4%, and alcohol in general, 0.3%. So while marijuana and vaping have the same past month usage rate in 2024, that's 6%, vaping is actually moving in a good direction while marijuana use has been holding constant. So that's kind of the national picture. Help us think about how to look at this data. The national rates are from 2023 and 2024. Now we're going to look at state data, which is just a little bit older. The NISDA uses 2-year averages, so you can better see trends over time. So what we're looking at here is the lighter green bars are data averaged between 2021 and 2022. The darker green bars is data that is averaged between 2022 and 2023. We're going to take 1 second for you to take a look at this. And Richard, I'm going to ask you to launch a poll about this data. So based solely on the data on this slide, which states do you think might need to be thinking about marijuana as a priority problem issue to address? You can select as many as you think it applies to. Give folks a second to take that in a little bit. I know you're juggling getting the logic model open, answering this poll. I'm sure you have something else on your screen as well. I appreciate you taking a second to weigh in here. Got about half of us have weighed in. Yeah, I'm seeing comments in the chat already. Curious about what Oklahoma did that was so effective. Yeah, great. As a reminder, as we're waiting for those to come in, once you click on the link, the Develop an Effective Program Logic Model, Technical Assistance and Training link, you have to actually click where it says download the logic model tool. That's where you're going to get the document itself. We are multitaskers. That's right, Jules. All right, I think we've got about, oh, look at that. 100% of you answered. Is that possible? Anyway, let me show you all what you came up with. So you'll see we've definitely got more people weighing in on Arkansas and New Mexico. The next one was Texas, with lower rates of you all thinking that we really need to be paying attention in Oklahoma and Louisiana. Here's the kind of trick of this question. There is no right answer, right? The context matters. What you're thinking about, how you're weighing these really matter, right? I do see this question. Yes, anyone can use this template. The data we're looking at is for Region 6, but this will work for everybody. So looking at the data, the context, the way that you're weighing these pieces are what matters, right? So some people may have said 100% all of these states are the ones that we need to pay attention to because having marijuana usage rates between 5 and 12% is a big number in every single state. So we should all be looking at it, right? Some people may have said New Mexico. Their rates are the highest ones. They're higher than the rest of the region for both points in time. That makes sense. Others might have said Arkansas or Texas. Those are the only two states where the rates are rising. Some people might have said Arkansas, Louisiana, and New Mexico, all states where the most recent data is above that national average. Any of those make sense. So as I'm asking you to look at this data, you can think about, any of these could be the reason that you make that call. Okay, so let me show just, I think I have one or two more data points for this so we can take a look. Let me close our poll. Perfect. All right, so here's some data around binge alcohol in the past month. Louisiana had that highest 2022-2023 rate, and it represents an increase over time. So I might be looking at binge alcohol for Louisiana here. Arkansas and New Mexico have also increased over time. Those are in contrast to Oklahoma, Texas, and also the national rate. So those are some things we might be thinking about. Finally, if we're looking at tobacco product use for youth ages 12 to 17, every state aside from Texas is above that 22-23 national rate. Every state in Region 6 also saw a decrease between those 2 points in time, with our biggest decreases in Arkansas and Oklahoma. And the highest rates in Region 6 are in Louisiana and New Mexico, which also saw the smallest decreases over time. So again, here's a snapshot of data points from one data source. I just wanted us to have some real data to look at as we're filling in our template. And again, you can reference these on the Google slides that you opened in the beginning of this. And if you need that link again, I'm certain that we can put it back in the chat. So we're going to use the data we just looked at, referencing those Google slides, and fill out the beginning of our logic model. So I'm going to switch over to my logic model template so that we can look at this all together. Of course, I want to get us back to the beginning just so we're all on the same page. Mine looks a little different than yours just because I started filling it out for this. You don't have to watch me type the whole time we're here. But it looks really similar to this. So we have our blank full logic model. And I'm going to go to my assessment tab. And what you'll see is that for the assessment, we have just that left side of the logic model, right? Just the problems and related behaviors and the risk and protective factors. And so we just looked at a bunch of data around problems and related behaviors. And what I'm going to ask you to do is take a minute to look through the data that we were just talking about. Make sure that we have that back in the chat if possible. And think about what are the problems that might be relevant to your state. And so if you're here from Utah, let's say, and I didn't present any data on your state, you can pretend that you live in Oklahoma for this exercise and use their data, whatever you want to do. It's just a way to use this to start thinking about things. So if I were looking at this, maybe I'm going to say that the problem that stood out to me was really underage drinking. And the indicator that told me that was nationally the highest rates of past month substance use for alcohol, or the highest rates of use were for alcohol, right? So these are national use rates. And that came from the first slide that we looked at, which was actually the NISDA, and that was 2025 data, right? So here I am just filling this out. Make sure you can see what I'm doing. Perfect. And then maybe I also am going to say that it was the binge drinking rates that really were alarming to me. So I'm going to say binge drinking rates for 2024 binge drinking rates were another one. And that came from the 2024 NISDA, and that was actually state data, right? That's the kind of easy way to fill this out. If I were spending just a little bit more time, it might look a little cleaner. So I have the actual statistic here, right? Nationally, 6.6% of youth ages 12 to 17 reported past 30-day use of alcohol in 2024. That's from our national 25 data, national data published in 2025. And then my second indicator is around this binge drinking in the past 30 days. That's from the national NISDA data from 2024. Take a minute. Fill out just these 3 boxes in your template. I'm going to give you a minute or so. Think about a data point that would be relevant to you. What I really want you to do is identify what's the problem, what is that indicator, what was the data point, and then what was the source. And the thought process there is that you can go back and check that source again in 6 months, in a year, in 5 years to take a look at this. Giving me a second to take a look at the chat and see that everybody is covered and buried in snow. And I actually live in Massachusetts, and we are also buried in snow up here. All right, as you're doing this, is there anybody who'd be willing to share what data point did you choose and what problem stood out to you on that? You're all thinking hard. So as you're looking at this, what problem behavior are you identifying and what data point are you using for that? It will get easier as we go, I promise. You have my example, right? My example is the underage binge drinking and the data points that I put in there. Does anybody want to share yours? And then we'll move on to the next piece of our logic model.
Katie, this is Michelle.
Hi, Michelle.
Sorry, it was taking me a minute to like shift through all the data. My state's not on here, but I would say I would pick Arkansas marijuana use in the past month, ages 12 to 17, because they're seeing a rise in 22 to 2023. And
Mhm.
that would be the National Survey on Drug Use and Health, would be
Perfect.
my data point.
Thank you, Michelle. That's
Uh-huh.
wonderful. Great. So marijuana use, we have our data point and it's coming from the NISDA data. Perfect. All right, so let's keep moving. Let's go back over to our slides because now we need to look at our risk and protective factors. There we go. So we're now in this orange part of the logic model looking at risk and protective factors, and we need to assess what factors are most relevant to our specific community. In this space, I'm not going to go over a lot about what risk and protective factors are, but if that's something that you need to brush up on, we can offer individualized TA and also point you to some resources. Just put that in the chat and we will help make those connections for you. So for these, we're looking at some data from the Youth Risk Behavior Survey. Similar to the process of using that relevant data to select problems and behaviors, we're going to use data to identify what risk and protective factors are relevant for our specific communities. This data comes from the YRBS. This is administered every 2 years, and not every state uses every question. So as we go, you'll see the dates are a little bit different. You'll see that we have data for some states and not others. So here are a set of risk factors that we're looking at. So this is reporting first exposure to substances having been before age 13, that early onset. And you'll see the lighter green bars are alcohol. The middle green is having tried marijuana. And then the darker green on the right is smoking cigarettes. So we're seeing alcohol is kind of highest across the board, total US and in each state in the region. And then if you look at some states, we're seeing, so Arkansas, Louisiana, Oklahoma, Texas, that the next highest rate is smoking cigarettes, but in New Mexico, the next highest rate is actually marijuana. This question, so high school students who usually got their electronic vapor products by buying them themselves at a convenience store, supermarket, discount store, or gas station. So this is really looking at that risk factor of retail access, right? So how many people are getting their electronic vaping products from retail stores? And I would look at this and I would say, 13% of people in Arkansas. So retail access might be something that a risk factor we really want to address. Whereas in New Mexico, I think probably the access is coming from a different point, right? And so we're really thinking about, based on where you are, what might be the risk factor that's most relevant here. This is looking at the protective factor of caring adults. So we're seeing in Arkansas and Oklahoma, almost half of youth are reporting that they really do have an adult who cares about their feelings. You'll notice here that we do not have data at the national level. We don't have data for some of our other states as well, right? New Mexico is not on there. Texas is not on there. So this will be a place where we start thinking about what do we do about data gaps, which we can also talk about. And yes, absolutely, Jerry. So you're looking at like, where does retail access around minimum age come into play, right? That would be another question to look at. Finally, on this high school youth survey, we have students who describe their own grades in school as being mostly A's or B's. So here we're looking at the protective factor of academic achievement. We're seeing Arkansas and Texas have at least 3/4 of their youth reporting strong academic achievement. Louisiana and New Mexico have around 2/3. So there's a lot of potential to sustain and promote this protective factor. All right. You have the data. Christine, great question. I was looking for data that was easy to visualize. You could see some of these differences and wanted to make sure that for each state in Region 6, there were a couple clear factors that made sense. So this was really just for the sake of presenting to you. But for you, you'd be really looking at the breadth of data, what stands out to you for your state when you look at all of the factors that are measured in these surveys. So let's go back to our tool and start putting this in. So I'm going to jump back over to my Excel so we can look at it together. Great. So you're on that same assessment tab, and all we're going to do is move from the blue side over to the orange side and look at what would be the most relevant risk or protective factors. So in this case, I have this filled out for you already. And I'm saying the risk factor I think we should be looking at is that first drink of alcohol before age 13, early initiation of alcohol use. And the indicator that I'm pulling is in 2021, 15% of high school youth reported first drinking alcohol before age 13. That's from the 2021 YRBS. I also want to pull on the protective factor, this high level of academic achievement. So in 2023, 72% of high school youth reported earning A's and B's for most of their grades. And that source was the 2023 YRBS. Your turn. Take a second, fill in at least one, you don't have to do more than that, but fill in one row of a risk or protective factor that feels relevant for the state you were looking at when you filled out your problem and related behaviors. And when we get to the last chunk of this webinar, and you have a chance to be in breakout rooms, you are going to be looking at the one that you've worked on during this. So take a second, make sure you actually get something in there. I'm going to pause and skim through the chat real quick. Make sure. Yeah, there's some really great dialogue in the chat about some of the contributing factors. Does anyone have any question or want to share your risk and protective factor? Give folks a second for that. Thank you, Michelle. So risk factor, age of first exposure to marijuana, use in Arkansas using the YRBS. Would the risk and protective factors be similar to local conditions? So I would say your local conditions are going to be everything on this assessment tab, right? Your local conditions are helping you understand what the problems are and what's contributing to them. So you're going to kind of be looking at the data and parsing it out into these two buckets. So it would be more of a root cause. These are really good questions, right? And cute baby Glenna. Yeah, so your root causes are sort of, so some people might take this logic model and put even another column on the left side before the problems and related behaviors. And that's kind of that environment, those root causes, some of those pieces, right? If you are, I'm going to stop reading the chat because I'm getting distracted as I'm trying to talk at the same time. Your interventions can focus on those root causes, absolutely. And in that case, for sort of blending in the root cause with the problems and behavior and related behaviors piece. I'm going to pause for a second. Nicole Shamborn, do you have anything to add to that particular question? So where do the root causes fit in here?
So I like to think of root causes as almost kind of a deeper layer. Your risk and protective factor are really going to be what is increasing my risk specifically in my community, or with protective factors, what is decreasing my risk, right? What is protecting us? And so I think root causes might go even a little deeper. But if you look at your logic model, you can kind of go across and say, okay, underage binge drinking is a problem in my community, but why? We have social access, right, to something. but why? And so you can keep going through that why series, but I do kind of think of root causes as being things that sometimes aren't as visible, maybe as even risk and protective factors to the community. So, and
Thank
there
you.
is a lot of research behind risk and protective factors. So I did put a link to a bunch of PTTC resources in there, because there is a lot of research behind each risk and protective factor that has been identified for substance use.
Thank you, Nicole. That's great. And I see in the chat a comment that this helps. Thank you. So great. I'm glad we were able to clarify that. Okay, so we have our assessment portion filled out. We have our risk, our problem and related behavior, and our risk and protective factor. Coming back to our slides, let's keep moving and thinking about how this all works together. So now we've used data to identify our problem. We've used data to identify our risk and protective factors. We're going to zoom out and look at where we're going, this kind of full logic model. So using data to determine the most appropriate problems and risk and protective factors allows us to select an evidence-based intervention that is relevant. It's important that our interventions are also evidence-based. So that means they've been studied, they've been evaluated, found to be effective when they are implemented with fidelity, and that they are a good fit for your specific community needs. Looking at the first half of the logic model that you created, can anyone think of in the work that you already have an EBI, an evidence-based intervention that would be an appropriate fit for your needs?
Amy, my name's Denise. Before you delve into that, I put a question in the chat. So what are your thoughts on using an environmental scan? So I've done some environmental scan on where youth and the population goes and taking pictures of products. Could we use that? It's somewhat anecdotal. Use that as a risk factor as far as social marketing or social norming, what they're visually being presented to that population. What are you guys' thoughts on using that type of risk factor anecdotally?
Yeah, so an environmental scan would be a kind of qualitative data, right? And so I think sometimes we say anecdotal when we mean qualitative data, and that's not a problem. But the reason I make the distinction is an environmental scan is a really valid way to assess your community and understand what's going on, right? And so I wouldn't discount it as just anecdotal. What it is another way of getting that data. So I would think about the environmental scan is actually that data indicator, right? So what we're seeing is high levels of social marketing geared at young people. That's our risk factor right there, is this, as you said, social marketing or age targeted marketing. And your indicator is this high level, and the source is the environmental scan. So there's no reason that you can only use like this national epidemiological quantitative data as your data sources. You can use anything in here. I've been presenting this because it's one way to look at it, but I am a huge proponent of mixing in these different data sources. You might also use focus groups with the youth in your community, or you might use a community survey that you put out yourself, right? So any of those can contribute to how you're identifying what your risk and protective factors are. Does that clarify?
Yes, and that's very helpful. I appreciate that.
Great. I'm glad. Perfect. Yes, I see lots of stuff in the chat, and I do recognize we're moving really fast. If this is your first introduction to logic models, it is really fast. So you'll get a recording of this, and you're welcome to come back and review it. We also have at the end some really great resources for like, hold on, slow down, where do logic models start? So we'll go from that as well. Nicole, I see you're off mute. Were you hoping to add something before I go on?
Sure. I just wanted to rest everyone at ease that we do offer intensive TA, and we'll talk about that later on, if you do want to get more assistance. And we are recording today, so you will be able to get this and go back and pause and watch. So
Yeah, thank you. And I appreciate that we're getting some EBIs in the chat as well. So for the Too Good for Drugs curriculum, the Botman Life Skills program, right? These are all EBIs that would work. When I was looking, just specifically trying to find something that matched the problem I'm looking at, so underage binge drinking, and really pulls in both this early initiation of use and high levels of academic achievement as a protective factor, I found a great program in the Blueprints registry, which we can talk more in the questions and answers about some of these registries, right? But I found a program called the Positive Action Program. So this is for ages 5 to 11 and 12 to 14. It's school-based. It has school-wide climate change and curricula. It has 2 different studies that have demonstrates the impact that it has on risk and protective factors, including early initiation of drug use and academic self-efficacy. And so that feels like a really relevant fit for the specific problem I identified and the specific risk and protective factors, right? That's one way that we're going to look at this. Well, registry of registries. Thank you for sharing that, Casey. Right. So in the Excel tool itself, now you can look at that whole full picture, right? And we can start to populate up from the tabs that we already created. So we have our our problem and related behavior that you already identified, and we can plug it in right here. So underage binge drinking is the problem. We go to our orange column, those risk and protective factors. We have our first drink of alcohol before age 13 and our high level of academic achievement. And then I have plugged in the Positive Action Program as my EBI. If you don't have an EBI to plug in right now, don't worry about that. That's not really the focus. I'm just sort of working it through so you can see where it would go. Okay, take a second, start filling in that tab, and we're going to start looking toward our short and long-term outcomes. And so pop quiz, for those of you who are familiar with logic models or have been doing this work for a little while, what is the difference between short, intermediate, and long-term outcomes? Or what are some of the differences? How much time they take to accomplish or achieve. Yep, that's great. What else? Time frames, months and years. We set 1, 3, and 5-year data points. Great. Great. So in general, short-term outcomes are measured right at the end of the program or very soon after it's finished, right? Intermediate outcomes might be within several months after the end of a program, and then long-term outcomes are usually a year or several years out from there. Depending on the program, that timeline might get stretched a little bit, but that's generally what we're looking at. And then I'm seeing, so behavior versus long-term change in knowledge, beliefs versus behavior, right? That those are what we're looking at too. So short-term outcomes are typically refer to changes in knowledge, attitudes, or behavior. So things like, I intend to do this, or I now understand this differently. Intermediate outcomes include actions by participants that are based on what they learned. So over the past 6 months, I have changed my behavior in this way. Long-term outcomes might look at changes in conditions and policies or in organizational structure. So, for example, a short-term outcome for a smoking prevention program for teenagers might be the number of teens who report that they do not plan to start smoking. That's an attitude piece, right? An intermediate outcome could be the number of teens who report not smoking at 6 months after that program ended. And a long-term outcome could be a reduction in the smoking rate among teens in the city, in the county, in the state, right? So it helps us think about short-term, people in the program just finished, what are they telling us? Long-term, what is the change that we're seeing because of this program? It's a lot easier to directly tie outcomes to short-term outcomes to your intervention because there's so much going into some of those long-term pieces. But again, using our logic model helps us say, based on this logic, we know that this short-term outcome is contributing to the long-term outcome that we're seeing. Great. So let's look at our evaluation tab in our tool. This is what I consider to be the fun part, but again, that's why I have this job, right? Well, this is us starting to take a look at how do we understand the impact that we're having. So I'm going to move us over to our evaluation tab, and you'll see we've got the same blue and orange because we are tying our orange, our short-term outcomes to the risk and behavior, the risk and protective factors. Sorry, I'm misspeaking about everything. Repeating that. We're tying our short-term outcomes to our risk and protective factors. So your short-term outcomes should be some change in that risk and protective factor. What I want to do, let me think about how the best way to show you this. I'm actually going to show you my slide one more time so you can see it before we fill this out. So here you go. You can see on the left, we have everything we filled out on our risk and protective factor already, right? We have what the factor is and what our indicator is and where it came from. On the right, we're going to take those same factors and we're going to think about how do we measure them. So what might be an indicator that we could measure right at the end of the program that might impact early initiation of alcohol use? What do you think would be one way that we could understand that? How do we know at the end of the program whether or not we are impacting early initiation of alcohol use?
Perception of harm?
Perception of harm. I love that. Great. So maybe we're asking on their post survey as they leave, we're saying, how harmful do you think it is to use alcohol at this age, right? I think it's kind of a big deal, no big deal, a very big deal, right? We might do a knowledge survey or a test among the students. Perfect. We might ask past 30-day usage data. That might be tricky depending on the length of the program, right? Because if the program has not been running for 30 days, then past 30-day usage data may not tell us much for a short-term outcome. That might be really helpful when we look out at our long-term outcomes later. We could do some listening sessions, right? We could instead of giving people surveys, we could have conversations, start to understand what was the knowledge that was gained from this. We might ask, in our post survey, we might ask about your likelihood of trying an alcoholic beverage in the next year. That might be one way to do it. Let's ask a different question. So what would be a short-term indicator that the protective factor of high level of academic achievement is being maintained or increased? GPAs, great, Jules. And we could look at that at a district level, right? Or at a school level. We don't need to see individual students' GPAs. But if we're seeing on average that we're keeping that mostly A's and B's, that's a great indication. Perfect. All right, so then I am going to show you how this all fits into our Excel. So we're over here on our outcomes tab, and what we're going to do is drop these indicators right in. So for our short-term outcome, decrease in rates of alcohol initiation before age 13, We're saying the percentage of participants who indicate the likelihood of drinking an alcoholic beverage in the next 12 months. And we're going to get that from the YRBS, let's say, or we could even, I'm going to change this. This is going to come from a post survey, participant post survey. And then we're going to say our second indicator is going to be that average GPA on the school district level. We're going to get that from school level records. Great. Yes, and I'm seeing more ideas in the chat too. Derek, thank you for adding those in. Take a second. Think of an indicator for just one of your outcomes. So think about what's the outcome that you want tied to your risk or protective factor, and what would be an indicator of that? Put it right in your Excel sheet. And then I'm not asking you to report out each time as you're going, but if you have any questions, we can talk about those before we move to our long term. How do we know that GPA ties to underage drinking? What we know from the research is that this academic achievement is a demonstrated protective factor around underage drinking. So that is proven in the research. And if you go back and look at some of the resources Nicole put in the chat, you can actually follow the citations of like what research shows this, right? Based on that, because we know we're using evidence-based and data-based risk factors, what we can say is if GPAs are staying high, we are increasing this protective factor, which will have an impact on that underage drinking. Does that make sense, Christine, and anyone else? Seeing blank looks in screens. Yes, kind of knew that, just needed explained. Yeah, perfect. And that's really what I think is like the gold of using a logic model, is that we can tie these things we can measure, like GPA, to the bigger process of change that's happening. Great. All right, so we're now going to do something really similar, but with our long-term outcomes. So whereas our short-term outcomes tie to our risk and protective factors, our long-term outcomes are going to tie to our problem and related behavior. So now we can sort of take that next step out. So if our problem was rates of underage binge drinking, right? That was the problem that we're targeting. So for our long-term outcome, what we want is to decrease those rates of underage binge drinking. So if our indicator on the problem side was these national past 30-day usage rates, what might be our indicator of a successful long-term outcome? So I'll repeat that question. What would be an indicator of a successful long-term outcome related to underage binge drinking? Decreased overall rate of binge drinking. Perfect. And we could use, decreased use. Great. We can even use the exact same indicator, right? Because we're looking at long term. Maybe next year we're looking to see if we've seen any decrease in that rate. Reasonably, like we're not going to see an 80% decrease because we ran one evidence-based intervention, right? And so here's the other thing that comes when we're starting to look at these evidence-based interventions. They will tell you what outcomes they can contribute to. So you can look at that to see what's a realistic change over a year, over 5 years. What's a realistic change if we implement this in every school in the district? We're able to do that for a solid 5 years. What might we see at the community level? So that is the long-term outcome that we're looking at. Great, percentage decrease in 30-day use. Jerry, I like your thoughts around fewer arrests, fewer hospital ERs. So those would be other outcomes that are related to the same problem, right? They're not as directly tied. I wouldn't necessarily, I would say that I'm looking for an outcome to measure that very much directly ties to this problem behavior. If the problem behavior we're looking at is um, hospital ER admissions, or we're looking at arrest rates, then I would have my long-term outcome tie directly to that and might look more at what are those rates of arrest and ER admissions. Great. I'm pausing for a second. I want to encourage you to put this in your logic model, in your Excel sheet, and I'm gonna just bring you over and show you what that looks like in mine so you can see the sample. So here I am. I've got my long-term outcome, lower rates of underage binge drinking. And my source is the National NISDA data, maybe for 2026. I'm looking at the exact same indicator, right? National level of youth ages 12 to 17 reporting binge drinking in the past 30 days, and I'm looking for it to go down. Pausing, looking for questions. I see that there are some in the chat, so let me take a look at what we've got. Oh, wonderful, Christine. I'm glad to hear that you're seeing that connection between the risk protective short term, problem behavior long term. I'm glad that that feels helpful. A link to the document, if we could put that link one more time. Thank you, Derek. You've got it. So when you click on that link, the Develop an Effective Program Logic Model, you have to actually click where it says download the Excel tool. Wonderful. All right, I know we're moving fast. This is sort of baseline. We're excited to talk to you more about your specific situation as we continue. If you want to do some, we do offer intensive TA around this and can do some of that work with you. Okay. Coming back over here, gonna move forward with our slides because we're almost at the good part. To get this to work for you, it is your turn to really dive in and try to troubleshoot some of this. So I am going to ask you to move into breakout rooms. I am noting how many people are in our Zoom right now. And I know that you're not all going to leave and run away when we go into breakout rooms. I know you're going to stay and be engaged in it, right? Because at the end of this, we are going to be talking a little bit more about future opportunities. So please stay. We don't run away. Thank you. I appreciate that. In your room, so what I'm asking is first introduce yourself to the other folks there. Know that everybody is kind of learning this tool for the first time. You may have filled it all out. You may have just gotten the first column there. Casey, I see. Thank you for being here for what you were able to. What I'd love to do is for you to choose one or two and to work through the logic model as best you can. Figure out what your questions are. Try to brainstorm a couple of those indicators. We are going to, yes, I can. I will post that in a chat before I send you to your room in a second, or if someone else wants to try to, Nicole or Derek, capture these prompts and put them in the chat so you can see them. So again, introduce yourself. Look at this. Nicole, Derek, and I are going to be popping into rooms just to help support as you go. We will be in our breakout rooms for about, I'm looking at the time, I'm thinking through where we're at. Let's do shorter breakout rooms. Let's just do 10 minutes for breakout rooms, if that works. Thank you. I see so many people. I do at least appreciate you all tell me that you're not running away because of the breakout rooms. Great. Okay, so Derek is going to release our breakout rooms. You have about 10 minutes, so you won't get into it too much. We can come back together and do some brainstorming together. And then we will come back as a group. Wonderful. So I am under no illusion that all 121 people in this room have a logic model created. That is totally fine. This is about using the time, space, and resources for you. But what I would like to do is take a few minutes now and just ask, what What feels useful to you about this tool? What questions are you stumbling on? Like, where is it sitting for you? That's what I would love to hear. And definitely feel free to put it in the chat, but also you can just hop off mute and share with us.
Hi, this is Debra from Dallas, Texas, Metro Care Services. I think we shared in our breakout, but when I downloaded the template, thought Excel, amen. Right. And someone said it in our chat, in our group, like the tabs are so useful. It just makes it very streamlined. And from my perspective, I've completed logic models before for other organizations and even my current organization. But not doing it in this format has been maybe a challenge, and not knowing if the information came across as clearly. And so, you create something like this and you can see exactly what you want someone to see and go into that space. And I think after I send, my report up, right, I don't know if they understand what I put in there, or if they're, connecting the pieces and the dots. And so that to me results in maybe unfulfilled goals or not coming up with longer term strategies or goals and things like that. So this will be the new format for Debra to use. So I do appreciate all the hard work and everything that you've done, but this is really a great tool, and I hope that other people enjoy it as well.
Thank you. I definitely think there are Word document people, and not Microsoft, but there are Word people and there are Excel people. And I, even as someone who loves qualitative data, am an Excel person. So I'm glad that
Yeah.
speaks to you.
I'm a qualitative girl, but man, it's just something about the way it translates, So I can tell a story. That's not the problem. I need y'all to understand the story when I'm not in the room, and I think this really does help.
Yes. Thank you. I see in the chat. So to Deepa's point, we talked about how rabbit traily logic models can be, and this format helps keep people on track as you work with your team, your community coalition. I love that. So I'm really hoping that we can move away from, we did a logic model at the beginning of the grant. Now it's in my file folder and I'll pull it out when we do our final report. And I probably won't edit it, but I'll just send it again, right? Moving from that to like, how are we using this as a regular benchmark as we go? What else? Are there other thoughts I want to make space for? Can you share the
I just wanted to
Sorry, go ahead.
add to that. Hi, I'm Tamil. I just wanted to add to that. I totally agree with Miss Zebra. Just the breaking down of the different steps, the different tabs. I think, just for me working in local government and even at the state level, you have, you have to keep the department's goals in mind. You have to keep those requirements and things in line. And I think it's a great tool to kind of help you stay on track, with whatever goals that your department or your organization might have at the time. And it kind of doesn't allow for you to kind of, go off track or, go into a loophole, as they said. So very organized, very strategic. Looks great.
Thank you. I'm really glad to hear that. What questions do you have about how to use it?
I have a question. This is Katie from Safe Yakima Valley. I have a question on what would be your recommended way to track where there may be data points missing.
Mm-hmm. And so you're thinking like this data is not available, but we wish we had it. Yeah. I mean, I think you can use the same tool, right? You can make it your own. So you could add just a row underneath each indicator that says like, here's what we're hoping for, right? Here's what we wish we had. I think we were having a conversation in the room that I was ended in about what do we do when there's not national data available or when the national data is lagging by a couple of years and we don't have that local data. And so I think the first step is really identifying like what's the data that you're looking for and tracking it however you are. And then I think being creative about how do we get that data, whether it's looking at, have you exhausted all the different sources to your area? Do you have relationships with the health department, with the criminal legal department, where you can get some data from them that might not be publicly available? Are you thinking about collecting your own primary qualitative or quantitative data, and what might that look like? So there's a lot of those pieces. But as far as the tracking, I would say make this your own. Add a column, add a row, put it somewhere so that it still ties to the problem or the risk protective factor. You're still putting it in that same logic bucket, but you're keeping track of what data you would like to be able to collect. Does that answer your question, Katie?
It does. Thank you.
Steve.
Yeah, I'm a big fan of logic models. I work with folks who are not. And when I try to push on the issue to find out what their hangup is, it feels like you have a logic model, but it doesn't tell you then what.
Mm-hmm.
Does anybody else have, so maybe building it's not the concern that we have. It's like, hey, now we have this logic model. Is it just this person maybe doesn't put assignments in their logic model and they should, like dates? I don't know if anybody else has had that issue. Having a logic model is one thing. Knowing is half the battle, right? If you're a G.I. Joe fan. So what's next? I want to be able to answer this person
Yes.
very well.
Yes. Nicole, I saw you come off mute. Let me go right to you.
Sure. So the next step usually is you want to develop what I call action plans, or some people call strategic plans, for those things that need a greater level of detail to make sure they're done. And that's where you would pull up like, okay, to tackle this particular outcome, these are the things that need to happen. This is the person responsible for each of the things, and these are the things we're going to do. And then those action plans you'll want to follow up on pretty regularly to make sure those things are being done to get to that outcome. So that's really the next step, is really detailing out that action plan. And I see someone wrote work plan. Yeah. Work plan, action plan.
Perfect. Yep. Thank you, Amy. Thanks, Nicole. I want to show you just like one more piece on this that you can sort of take in, and then we'll have another opportunity for questions as well. Yeah, and I see that question in the chat. So Christine, I will come back to that. So then sort of putting it all together, this is what we've already been doing, right? But just looking at that we're able to build out across, we see the blue columns line up with one another, the orange columns line up with one another. We've got our EBI in there. It all looks beautiful. What I like about the Excel is that it helps us build out, because we're not typically looking at just one single problem or behavior. Sometimes we're also not even doing just one EBI, right? We have a lot going on in the programs that you all are running and working on. And so while I would say, don't get too hung up, especially if it drives you nuts. Don't go crazy about making all of the rows line up, and you see how they're all kind of misaligned in here. But when you want to, you can actually make this a little more complex. So for instance, maybe I'm not only looking at this problem behavior of underage binge drinking, but I'm also looking at illicit drug use among youth, or among these 8th graders, let's say. So while I have a protective factor, or a risk factor, excuse me, of this early initiation of alcohol use, I have protective factor of academic achievement. Those both kind of contribute to the underage binge drinking. But when I look at illicit drug use, I'm also seeing this risk factor around social access. But the protective factor of high academic achievement, it is also applicable and also has been researched to be a protective factor for illicit drug use among youth. So I have it sort of tied here between the two. And so my positive action EBI really was focused on binge drinking. I'm going to add another EBI around minimum sentencing legislation or, whatever feels like the right approach to your community. Then I have a short-term outcome. I'm keeping these same ones with the risk and protective factors, but I'm adding one that measures the social access piece. And I'm adding, oops, excuse me, I clicked by accident, adding a long-term outcome that looks specifically at these rates of illicit drug use. So you can use the Excel to kind of align across strategies, align across risk and protective factors as well. If that's something, if you are someone like Debra, who the Excel just makes your ears sing, you can really go into it and use it to kind of play with those pieces. I do want to show you there's two more tabs in the Excel that I think, if this is really singing for you, that can be really helpful. So let me just show you if we go along the bottom here. You will see some logic models actually build out even further between the EBI and those activities. So this goes to your question, Steve. Some people might put their activities right into the logic model. Some people might have your intermediate outcomes in the logic model as well. So this is just another template you can use if you want a slightly more complex model. And then the final tab, because the logic model should really be driving your evaluation as you go. And that's how you're measuring if you're meeting those short-term outcomes. So you can also just take the outcomes directly over from those other tabs. You can put all your indicators in, all your data sources, put in who's going to do what, building your work plan, where are you keeping your data? There's a place to put all of that in one place. And this we did not create. This was adapted from the Evaluation Support Scotland, which is another great resource. So that's just all in there as more resources that you can use as you dig into this. Come back over. We're getting near the end of our time together. We have more time for questions and answers. Anything else that's coming up for you? And I'm going to sort of scoop back in the chat, see if we got everything. Right. Definitions are in there. Perfect. Wonderful. Anything else you want to ask in this space before we talk about some other resources we have? The time frame for the outcomes breakdown. Yes. So typically, I would say short-term outcomes are right after a program ends, or maybe like it might be the last day of the session. It might be like a week later, you send a post survey, something like that, but they happen really quickly. Intermediate are usually a couple of months, maybe 6 months out, 3 to 6. And then long-term, might be measured at the 1 year mark. You might be looking really at a 5-year outcome, right? And often those timelines are going to align with your funding. And so you need to be thinking about, what does your funding source need and when do they need it? Is that going to allow you to think about a 6-month check-in, a 1-year check-in, a 3-year check-in, and kind of shape that way? To have a place to put the strategy used to address the RMP factors. So I would think of your strategy as that EBI, that evidence-based intervention, and that evidence-based intervention should be chosen because it addresses your specific risk and protective factors. Great. Good questions. And Lisa, nice to see you. All right, so let us tell you a little bit more. So we've mentioned a few times, thanks, Lisa, that we have the ability to offer some really customized supportive TA around this. Nicole, I'm going to invite you to talk a little bit more about that opportunity.
Sure. Thank you, Katie. And you all have done an amazing job today. This is a tricky topic, and that's why we're here to offer some more intensive TA as well to those in our region. So we are offering free customized logic model assistance this year for prevention systems, starting today through September 1st, 2026. You do have to be located within our South-Southwest region, which includes Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. Hopefully, I got everybody there. Katie, correct me if I missed anybody.
You're good.
Okay. And we can only get one request per organization, and that will involve one on-site TA visit and a follow-up virtual TA, which can be multiple sessions. This can be broken up into multiple sessions or longer sessions for a total of 25 hours. So, and again, that's free technical assistance. We just ask that you share your program information activities with our region to draft a usable logic model prior to and during the technical assistance. If you are interested, I'd be happy to check on eligibility for the TA. Just feel free to email me at nicoled@ou.edu and we can set up a little chat to talk through it. So I'd love to hear from you.
I was starting to type, but I'm not going to get there. There was a question about what regions we are. So the Southwest Prevention Center, which hosts the South-Southwest PGTC, covers HHS Region 6. Our prevention center also works with SPTAC, the Strategic Prevention Technical Assistance Center, and they cover Region 6 and 7. So I saw the question come from Kansas, just clarifying our PGTC works with Region 6. I will be sharing my contact information in a minute because I saw that was a question as well. So that's coming up in the slides. Before we get there, we are data people. We're talking about outcomes. We really would love to hear from you about your experience of this webinar. So if you can take just a minute or two and fill out our feedback survey, we use the results of those surveys to plan what programming we're able to offer you all in the future. We would really, really appreciate that. And Richard will be putting that in the chat. And then I'm going to flip to the last two slides and I'll come right back to this so you can see it. But here's my contact information. Please feel free to reach out to me. If you are not in our region and you still want some extra support, we will connect you to the right people who can do that for you. So feel free to reach out and we'll make the connections as needed. You are in our region. We'd love to have more conversations with you as well. I do want to share with you just a couple of resources. These were also linked on the webpage when you downloaded the Excel tool. So if you're looking for some more information about logic models, we have a recorded webinar on this practical guide to logic models where we do introduce the same tool. We also have a series on developing effective program logic models, so you can take a look at those. And then we do have the references for everything that we went over today included here as well. You will get these slides, this recording, and all of those resources emailed to you in about a week from now.